Hi, Felicia. How are
Hi,
you?
Felicia.
Hello, thanks for having me. Since our time is limited, I'll jump right into it. Please explain how Ali's Law is meant to
Okay.
be used in times of medical emergencies.
Well, Ali's Law, or the Restroom Access Act, states that anyone with a medical emergency must be allowed access to an employee-only restroom. And the language of the law is somewhat different in each of the 12 states where it has passed. But generally, anyone with a medical emergency, such as Crohn's disease or any other medical condition, would gain access to an employee-only or private restroom when needed.
Is there any particular language that you would need to use, or can you just say, I have a medical emergency, I need to use your
It's
restroom?
That's a good question. It's actually different in most states. Some states go by the honor system, where if you say you have a medical condition, they will have to believe you. In other states, you need some form of identification, which different organizations supply a card that says, I have Crohn's disease, or I have ulcerative colitis, or some other medical condition where I would need a restroom.
I see. Are the laws written to cover only inflammatory bowel diseases or also other medical conditions that are more susceptible to having GI issues?
Well, at least for Illinois, I know that it is more than IBD, which is Crohn's disease, ulcerative colitis. It also applies to pregnant women, the elderly, people undergoing chemotherapy, people with diabetes, a list of different conditions, even more than those where it would be applicable to the legislation.
That's great to hear. I must say that I admire your courage to share your story to help change the environment for us all. As someone suffering from irritable bowel syndrome, I've gotten sick in New York City and been denied the use of bathrooms as well.
Thank
I was embarrassed about those situations until I realized how many other people with IBS have had this happen as well. You were so young when you were fighting to get Ali's Law passed. How did your peers react to your story?
Yes, so this was going on when I was 14 and 15 years old, where I was trying to get it passed originally in Illinois. Actually, if you're from New York, it's pending right now, so that's very exciting. But back in Illinois, when it was going through the legislative process, my friends became some of my biggest bullies in the fact that they were sick of me being sick, which they'd actually told me in person. They didn't like the attention from the law. They didn't understand why it was necessary. And that's why it's so important to speak out and to become an advocate, because, as you know, it's really important to educate everyone about this so that no one feels alone and people know that they are not alone in this.
Did your experience make you want to be more involved in health activism throughout your life?
Definitely. I mean, through this experience, I learned that, restroom access is, of course, not the only symptom that people with Crohn's and other digestive diseases have, as Dr. Rubin could go over, but it's also important to find a strong support system, have a voice, seek out resources such as crohnsandme.com and ccfa.org, and just be an advocate. I am very passionate in the cause, and I am appreciative for everyone who gets up and speaks and overcomes their challenges.
On the medical side, how often do you suggest IBD patients see their GI doctor for overall care post-diagnosis?
Right. Well, thanks for asking that question, Felicia. The treatment of Crohn's disease is usually in two phases. The first phase is what we call induction of remission, and that means we turn off the inflammation and make the patient feel better, and we want to do that as quickly as possible. And the second phase is about maintenance. So because Crohn's disease is a chronic condition, like any chronic condition, it needs some type of maintenance therapy or the disease will come back. And so we have a phase of maintenance where we're trying to prevent flares and prevent relapse. And fortunately, there are some very good therapies now that do that extremely well. The longer we do that, the more likely we are to prevent surgery or prevent hospitalization or disability. So when you're feeling well, it is important to see your doctor once or twice a year and make sure you get some labs, make sure you talk about any changes or advances in the field, and then you have the opportunity when you're well to talk about other things like, do I need a bone density? Should I get a vaccination? What else do I need for my health care? You don't want all your health care with a chronic condition like Crohn's to be what I call crisis management. You don't want to be only going to the doctor when you're really sick, because then you don't have the opportunity to gain the upper hand with this disease and really control it.
I completely agree with that. I have IBS, fibromyalgia, and a few other conditions, and it makes such a difference when you're proactively trying to live well.
Absolutely, and we're so grateful to you for sharing that message and for working to get the word out about all these things.
Thank you. How often are patients misdiagnosed with IBDs or IBS when something else or a different version of those things are going on?
Well, because Crohn's disease and ulcerative colitis are most often diagnosed in young people, it is usually mistaken, at least initially, for an irritable bowel. Now, both disorders, as you know, can be disabling, and both disorders can be chronic and can affect young people. And IBS is much more common. So if you're a general doctor or a school nurse or a gynecologist and you have a patient complaining about bowel symptoms, the most likely thing is going to be it's an irritable bowel. So very often, especially with Crohn's, where it can be involving the small bowel and there aren't obvious symptoms like bleeding, patients are told they have an irritable bowel and the disease goes on for a long time before they finally have a diagnosis. Part of what we want to do is raise awareness, because early diagnosis allows early treatment, which then leads to more effective treatment and preventable outcomes. So it's a common problem. That's why we're raising awareness.
When I was originally diagnosed with IBS, my primary care physician didn't even see a need for me to see a GI doc. I pushed to see one because my symptoms were so severe that it was hard for me to leave the house. My GI doctor didn't see a need to test for IBDs, so it wasn't until years later that I saw a new rheumatologist who wanted to make sure that I didn't have one. In what scenarios would you suggest that someone with severe symptoms who has gotten an IBS diagnosis look further to make sure they don't have an IBD?
Good. Sure. So that's an important question, and the reality is that an irritable bowel syndrome has to do with at least 12 weeks that may not be continuous of symptoms, but frankly, anyone who has symptoms that long needs to have IBD ruled out before we actually can confidently say IBS, especially and always if there's any laboratory abnormalities or any extra-intestinal manifestations. So with fibromyalgia, as you know, you have muscle pain and sometimes joint pains. People who have joint pains or who have seen any bleeding or whose labs are abnormal, and kids who stop growing or haven't developed properly, even if they don't have obvious GI symptoms, all need to have a careful exam, usually a colonoscopy, to rule out something like an inflammatory bowel disease or Crohn's disease.
Speaking of colonoscopies, so many of us struggle with the prep for them. Probably even more of us with fibromyalgia do, since we're overly sensitive and not feeling so great to begin with. Do you have any tips for making that process any easier?
Well, one of our messages today is about seeing a specialist, and fortunately there are some new preps that are much easier to take, and if you talk to your doctor you can find one that's going to be better. But the last message is really, if the disease is under good control, you will need fewer colonoscopies. So if that isn't motivational for everyone, that I can't think of a better way to do that. But really, stable disease control means less need to be looking all the time.
Thank you both for taking the time to share your story and message with us.
Well, we're really grateful for the opportunity to talk with you, and we'd love to do this again some other time, Felicia. Thank you so much for having us.
Yes, thank you.